evening from Israel, one side of the globe, good afternoon from Canada, another side of the globe. And we were just thanking the internet because we love it in many ways because it brings people like us together, and it's really wonderful. And we're using it in the best way to promote healing. So my name is Dr. Tovah Goldfine. This is TMS Roundtable. We are live here in the studio, in my virtual studio, with MARNIE GLAVIN. And I will tell you why I love all my guests. You guys all know that I love all my guests for various reasons. But I'll tell you why I'm excited to have MARNIE in the studio. I met MARNIE because she was involved in the pelvic health support page, and I wanted to promote, for the roundtable, and we started talking. And she is in a great, amazing recovery program with her own pelvic pain, which we'll talk about. But what a lot of people did when they recovered from their pain or when they're on their healing journey is they went and they became a coach, and they began to promote it because they were just so enthusiastic about, like, oh my God, I've healed myself. I'm on a healing journey. I'm feeling better. I'm going to go help others. And that's what we all want to do. But what MARNIE did was she didn't become a coach, but she got very involved in she developed a support organization. And it's the first time in my 5 years of doing this work that I've met someone that really has done that. And you're a real advocate, and it's your business, it's your life, it's your passion to help others. And you probably are some kind of coach anyway. So otherwise, all that to say is I'm really happy to meet you, have you bless my studio. I like you to share with the audience, not only your story as much as you'd like to share about how you've been recovering from pelvic pain through this amazing approach, biopsychosocial, psychological, and then also how you started your organization and how you're helping others.
Absolutely. Well, thank you so much for having me, Dr. Tovah. Thrilled to be here. I'd love to sort of tell you how I started everything and came to be here. I think we were just discussing briefly how conventional medicine can often fail people who struggle with pelvic health conditions, especially when they don't require surgery or don't react well or enough to medication. So for me, the conventional system did somewhat fail. I used to think that was the only place that I could go. I started having issues back when I was in my early 20s. So it was just at the end of my university degree dealing with what I had no idea. I had never heard of interstitial cystitis. I had a UTI before, a urinary tract infection, but it went away with antibiotics and life went on. However, when I was in my early 20s, I had a UTI, what I thought was a UTI, was treated with antibiotics. The UTI symptoms did not go away. They put me on another antibiotic. Still, the symptoms didn't go away. So that was when they said, okay, let's explore and figure out what's going on here. So I had to go for a cystoscopy, and I was in a place in London, Ontario, which was about 2 hours west of Toronto. And they did the cystoscopy without a general anesthetic, which was very uncomfortable for someone who's dealing with interstitial cystitis. So I always recommend when people are told that they're going to have a cystoscopy with hydrodistension, that they should ask for a general anesthetic, because they often.
We're talking about a very sensitive area. I know I've spoken to men and women, and you're saying maybe the doctors weren't so sensitive to you at the time either.
Yeah, I guess the expense too, right, for putting someone under, but it just makes the experience all the much better,
yes,
much more tolerable. And I had to have it twice, so in the sense that it ended up costing the healthcare system more money as a result, because the first time I couldn't handle the procedure.
Wow.
So I wasn't diagnosed with IC until the spring of 2023. I think the first time I had the cystoscopy was in February, so it was a couple months or 3 months later, about 3 months later, that I had it again. And so yeah, so it was a rough thing to be diagnosed in my early 20s with a condition that they say there's no cure for, they don't know
Do
much
they ever
about.
say, I'm sorry to interrupt, do they ever, like, I don't go to doctors very much, even though I am, when I don't go, do they
Yeah.
say, do you say, why did this happen? How come my body did this? Why is my body creating this inflammation? Like, do you think, do they have an answer for that? Because you wanted to know how this happened. You're just in college living your life.
Hmm. No, there was no explanation. And I think, from my own research, it just seemed like it was very poorly understood. It was a very poorly understood condition with very little research, very little education. General practitioners, I think they get about an hour on the condition in medical school.
Wow.
So that's the thing. And then when to see a urologist in many countries, often urologists want to, do surgery because surgery is often where they make their money. So people who have conditions like interstitial cystitis, bladder pain syndrome, um, there's not much that the conventional doctors can do. There is no surgery unless you have a removal of your bladder, which is in dire cases and very rare. They can cauterize ulcers. People have a IC with Hunner's ulcers. If they are seen in cystoscopy, those can be cauterized. They usually come back. But urologists, there is in Toronto, which is a city of over 6 million people, there is not one IC specialist anymore.
Wow.
There was one. Unfortunately, she retired. She was my doctor, and she had, tried to, really get IC, help for IC, that she wanted to start a pelvic pain research center, and they just couldn't get the funding for it, and it
Wow.
just never happened. So just really unfortunate. And, endometriosis is another one that's just, so many people struggle with endo, and people wait so long to get treatment. You have to
And
go if you want to get.
pelvic pain disorder, like vulvodynia, these are all similar
Mhm.
issues. And, they're all coming from something in the body creating enormous inflammation out of
Mhm.
protection. So this is what we're finding out. So continue. So you got these tests, and did you get treatment, and did you get relief?
So I went on a medication, probably, I think it was probably about 6 months after. I did go on a drug called MARNIE, which is a drug that was prescribed, and it was specifically for IC. And it has now been shown to be linked to retinal maculopathy. So it can lead to blindness. So
Oh God.
clearly, most people try to get off of it if they're on it. There have been people I've spoken to who've had issues. There's a whole bunch of lawsuits going on with this drug. So unfortunately, I do not recommend
Well, they call it,
anybody take
yeah.
Elmaron. I was on it for a very short period of time. It did not do anything for me. They usually say, if you don't have any success with it within 6 months, then you just discontinue it. So
Wow.
I wasn't on it for long. And then I did start taking a tricyclic antidepressant, which is used for a lot of chronic pain conditions. It's an anticholinergic, and it's called amitriptyline. So that drug is, widely used for chronic pain conditions like migraines.
And
People
why
who
would
get
they,
migraines.
can I ask your opinion? I mean, why would they doctors give you an anti-anxiety drug for pain?
So it's an anticholinergic, so it blocks receptors that lead to,
Right.
urgency, frequency, and pain. So it does help. And unfortunately, I'm still on it, and I have been on it for 20 years. I'd like to get off. I'm on a low dose,
Yeah.
but a very low dose. Dr. Nickel, he's a very world-renowned urologist, says, it's the dose you're on is so
Yeah, listen,
minuscule. I
if
don't
it's,
think.
I know you and I are all about, a biosocial psychological approach. And if that means integrating medicine, if that means
Mhm.
a holistic approach, if that means a multidisciplinary approach, all the mind body doctors I work with always talk about integrating. I'll say, go get your chemo, go get your radiation, just understand your relationship with your,
Right.
your disease. And this is what we're talking about. So,
Mhm.
so what started you to understand that there needed to be something psychological happening and something social helping you? What made you think that this is more than just physical? What made you start to understand that?
Stress. So stress was my biggest trigger and remains to be my biggest trigger. And it's automatic, right? Like, say I have an argument with my husband, I will automatically feel it in my bladder.
Yeah.
I'll have issues with retention,
Yeah.
not being able to fully empty my bladder, frequency will increase, urgency will increase. So it's almost
So
like
what do you think? So what's happening? What's happening in your brain and body when you're feeling stress? What's
stress.
happening?
It's a stress response, and the bladder is connected to the mind,
Right.
and
And
they're working together.
right.
And when the brain is under stress, the bladder is under stress.
Yeah.
So it really comes down to figuring out what works for you to reduce the stress in your life.
Right.
And I always tell that to, there's so many phenotypes of IC, um, people who have sensitivities to chemicals, laundry detergent, whatever. People who have hypertonic pelvic floor, so their muscles are very tight. People who have the Hunter's ulcers, like I said. So there's all these different phenotypes, so different treatment options for each phenotype. But for every single phenotype, stress reduction is number
Right.
one.
Right.
It's number one.
Right. I want to interrupt and say to our listeners, it's not like we have to get rid of our stress, because that's also a conflict.
Possible.
It's about understanding our relationship with our stress. Like, yeah, I get upset when I argue with my husband. Okay, so let's figure that out, how I can relate to myself being sad that we argued or being angry, and how I would, what we call channel that. So somebody say, well, I'll go have a cigarette or I'll go have a joint. And I'll say, okay, I'm not telling you not to do that, but let's see if you can be your own cannabis. Let's see if you can be your own anti anxiety. Can you somehow calm yourself down, go journal in a book, go write your husband a text and say, let's talk about this over coffee later. Somehow find different ways, healthier ways of not getting rid of your anger, but understanding it and channeling it. And this is all part of the CBT and all the neuroplastic work that a lot of us are doing, and understanding that we don't have to put a conflict on a conflict. We don't have to bark at the barking dog. We can be calm, know that we're feeling really pissed, know that we're feeling really fear. And I did a little YouTube last week about sometimes you have to walk into the situation scared. So you have to take your anger. So tell us on that note, what did you do with your stress and your anger? Did you invite it in? What did you do with it? Did you go for a jog? How did you start to manage your stress in a healthy way?
Toning down the alarm, right?
Good.
Instead of panic, just how do you bring that down to a level that's manageable? So there's lots of tools, and my site, we explore the tools with mindful movement, with breath work, meditation. Diaphragmatic breathing is really great for people who have pelvic health issues.
Amazing.
Even actually, there's a woman by the name of Shelley Prosko. She pioneered physio yoga, and she even has, for people who have, constipation, urinary retention, because pelvic health, obviously, bathroom habits come into play. And she does a toilet meditation that is
I love it.
incredible. It's been translated into 6 different languages.
I love it.
And it's incredible and so helpful for a lot of people who struggle.
No, it's really important. It's important because they're the moments, where you're most stressed. So
Mhm.
very good point. I'll get that link and I'll put it on my Facebook.
Yeah,
But so
for
tell
sure.
us, so you started to understand your situation. You got relief. You were able to manage and understand. And then what point you led into this because this has become your full-time work now.
Yeah. Well, this is a long time. So we're going, like I said, I'm not not to let everyone know how old I am. I mean, I'm pretty much an open book, but um yeah, half my life. So it took a
Okay.
while to, I was working in marketing and PR, advertising for a long time. And then I just got to a point where I was like, I don't feel like I'm serving anyone doing what I'm doing right now. And I really wanted to, how you said people often, turn to coaching and want to help people once they've sort of gotten to a better place with their own condition. So I thought, I'm going to try something different and I'm going to provide a resource for people who are struggling. Because another thing is, cost is a huge component in health, right? There are a lot of people out there who've spent a ton of money trying to figure out what will work for them. And they're just, like I'm out thousands of dollars and I'm not in a better place. And I wanted to provide a resource free of charge for people to be able to explore the different options that could be beneficial for them, that could help them, and navigate the system, right? Because it's difficult, and people have no idea. Like most people who don't have a pelvic health condition have no idea what a pelvic floor does. They have no concept. Um, and it's unbelievable. And I'm
It's
just,
a real foundation for the whole body.
it is. And people have no clue. And it's understandable because they don't teach about it in school. There's no section in health ed. And there wasn't back in my day, and I continue to hear there isn't really much about it now. And even women going through um, perimenopause, they're going in blind. They have no idea what to expect. A lot of people want to go in blind, but then there's people who are just like,
Yeah.
what's wrong with me? Why am
Hungry
I
for
anxious?
knowledge,
Why am
sure.
I,
Yeah.
just dealing with atrophy?
Yeah.
Why am I, all these symptoms that come along with it?
Yeah.
They don't even realize what it is. So, so I started a support group originally back in, I guess it was 2019 or I guess it was 2019. I think it was 2019. Yeah, that I started and I started supporting people who had IC. I would have conversations. I'd open, um, up chats for them to sort of help them explore whether it be supplements that could be beneficial for them, helping them with diet, helping them with stress reduction, and just finding doctors, finding holistic practitioners,
Mm.
understanding pelvic physiotherapy and how that works, because a lot of people don't know what that's all about either. So it was just really, helping educate. And then I decided to turn it into a platform. And it started out to be Canadian centric.
Yeah, I
And
just want to see that word. I want to just compliment you on. I was looking over your site called Pelvic Health Support. I'd like to just put it up here. It's www, right?
Mhm,
www pelvic health
mhm,
support dot Canada, right?
that's CA.
Dot
Yeah.
.ca. And what I loved about it was it says patient centric.
Mhm.
I don't see that term, and I really
No.
think you thought that out. You thought that out. You really were interested in the people. It's like,
Mhm.
really, 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 I'm happy to keep promoting that. You're not
Yeah.
just an organization, you really are out for the people. So go ahead. So you opened up the platform, you're calling it a platform.
A platform, yeah. So I run a support group, which is on Facebook, and so in that group, I often like every week we post a guest blog written by a practitioner, and so that blog gets promoted And so I use the Facebook group to showcase that blog.
Yeah.
I also have, a Facebook page, an Instagram page. So it all gets promoted through so that people can read. And the blogs are excellent. They're really,
Wow.
really well written.
Yeah.
We have pelvic PTs, we have OTs, we have doctors, we have, everyone writing,
Yeah.
and they're just super helpful. Some of them are condition centric, some of them are based more on general pelvic pain, um, exploring things like breast cancer and having treatment, and then how it can impact your pelvic health, because a lot of people don't know.
Yeah.
Same thing with people who go through gender affirmation surgery. So pelvic PT is super beneficial for them prior to and post,
Sure.
to help them with urinary incontinence issues that they could have.
Sure.
So it's like there's all these things. So I'll join support groups and post in groups where people have, whether it's things like, Ehlers-Danlos syndrome, which is a hypermobility condition, and they have issues with pelvic. So it's all these conditions can sort of intertwine and no one really knows. And then they have these pelvic health issues and they're kind of like, what's going on here? And so I'm trying to help educate as much as I can. And so it's, it's targeted reach. We're targeting the people who are struggling. So that's great what, we can do with the Facebook support groups, because I think my reach through all the groups is close to 5 million people.
Wow.
So it's just a lot of people who are struggling, and there are,
Hold that note. I'm going to get back to you, but I wanted to answer Jackie's. Can you see Jackie's question on the side?
Mm-hmm. So, after UTI, I would have hung up. So there's some functional differences in this husband. Yes. AIDS detection on standard. Yeah. There is. I don't really like to go to that topic because it is very controversial. And there are very few doctors who will treat embedded infection with long-term antibiotics. The problem with long-term antibiotics is it can wreak havoc on the rest of your system. So you can be doing a lot of damage to your gut, to your overall health. And so that's why you will not find many conventional doctors who will treat. There was one in the UK. He's actually passed away. And there's Dr. Fundrick in Louisiana who does treat embedded infections, but it's a very difficult one. The best person, and you should probably listen to my my YouTube video with Dr. Curtis Nickel, and he does address the embedded infection a bit in that video. So be best to listen to that. I'm just, it's a hard one to
Well,
address.
I'm gonna chime in and then think about
Yeah.
what you want to say, because what I'm chiming in, Jackie, is that I'm always about treating the symptoms, but I want to know where it's coming from. Why did your body not respond to the antibiotics?
Mhm.
What's going on, in your life? What's going on biologically, socially, psychologically? Not because you're to blame, like what's going on with Jackie. It's more like, how can we empower Jackie? How can you be empowered to understand why your body would attack itself by an infection? Because an infection, a virus, it's an attack. It's an immunological internal attack of some message. Especially if you're not responding like in the way that, like, okay, antibiotics, I feel better. Why is your body not letting in the medicine? What's going on? So we look at a neuroplastic way, we look at the psychological, we look at the social, we look at the biological, we try to understand. And I think, rather than pushing you down the rabbit hole with many, many doctors, which I hope you find the right one, understand yourself, don't feel like a victim to this condition. Understand that you're worried and you're scared, and it's make sure that you feel angry, and get involved with some of the people like Marnie who can give you a psychological point of view, or some people that I work with. I just want to say, in the Physio-Psychological Disorders Association, which is run by medical doctors. It's the organization that I work with and that I learn from. Pelvic pain and these pelvic problems are one of the big physio-psychological disorders, meaning it is physical, your infection is real, there's no faking here, there's no like it's in your head. But where it's coming from, there's a greater psychological reason and or neuroplastic reason why your body keeps creating inflammation. And that's why so many people heal from the psycho-bio emotional approach. And so that if you wanted that answer, Jackie, I gave it to you because you're in the right place, because there's I have tons of resources about pelvic pain and healing, and a couple of stories on my YouTube of people who have gone through pelvic conditions. So don't give up. That's for sure. You're in the right place, and you have lots of support from us women here. So were you thinking of another response?
I think the best thing to do in this situation is definitely see a naturopath, because there is, you need to obviously be on probiotics if you've been on antibiotics long term, to replenish your flora in your gut. If you continue to, I'd love to be able to have a conversation to sort of figure out more why, because the bacteria continues to, it looks like you're seeing bacteria. Do you know what type of bacteria? Are they treating with the right antibiotic? Are they putting you on, are they treating you with the same antibiotics? You might be, potentially.
Right. And is it possible, Marnie, that the infection is gone, but they said the pain remained? Is it possible that the infection is better, but the pain remains because of learned pain, because of a conditioned response?
Yes. But if there is still bacteria showing, then you would, if you are still showing that you are
then you
dealing with infection, then we have, you need to figure out what the cause is. And then from there, there's obviously things you can do to sort of, again, reduce your stress, because this is a super stressful, when you have constant infections, wreaks havoc on your mental health. And then people just not knowing doctors not knowing what to do, not knowing how to treat. It's a vicious cycle, really. People who struggle with embedded infections, and that was sort of why, it is controversial, because there's people who say that embedded infections don't exist, and there's people who say that embedded infections do exist. So it's a very complicated topic, and because of the treatment being, long-term antibiotics, it can be detrimental to your health. A lot of doctors don't want to go there, like I said. So it's one of those things that, I'd say a naturopath would be best to deal with. Continue, have, get yourself lots of urine cups, and so that you have them on hand, so you can take them over to the lab without having to go to the doctor every time. Make sure they culture it, determine what bacteria is present, and then go from there. But it's unfortunately it is a difficult one, and the brain work with this one is the hardest, I would say, than any other condition, probably out there.
I think what, Jackie, you're getting from here, and I might have seen you before, Jackie, maybe one of my shows, your name's familiar, but an educated patient, doctors are getting more and more comfortable with their patients asking questions and wanting answers, and working together. Let's collaborate together and figure this out, doc. Let's figure this out. What do you think? Or, and there are some people who are seeing changes with nutrition, which is not my field, but phenomenal, because there's a relationship with our food. There's a relationship with everything we put in our body, and that's the brain. And that's the immune system, and there's herbs and things. And I know you have lots of things on your website. So talk more about some of the psychological, biosocial, talk a little bit about why you focused on the PBS, which is biological, psychological,
BPS, yep. Biopsychosocial. Yeah.
social.
Yeah. Well, because it's everything is affected, right? And the problem is people don't often see, they'll hurt their elbow and they'll feel pain, chronic pain in their elbow. And they'll be like, well, I hurt my elbow. It's not in my head. Someone will say, oh, like you've been suffering for 6 months. Maybe it's not, and they say, I'm not crazy. It's not it is coming from your head. The brain is your central nervous system, and it is where pain comes from. So people need to sort of understand that correlation between pain and the brain. And that's a struggle because people, for some reason, with a stigmatized mental health way of thinking, it's hard for people to sort of grasp that pain from a different part of their body is stemming from their brain. And so that's the first thing that you kind of have to grasp. It's a concept, right? And once people grasp that concept, then they can start working with it and understand how much power the brain holds over your pain.
And let me interrupt. The brain is protecting you, not punishing you.
Exactly.
It's protecting you, and that's what it does. That's what it's trained. That's the prime, the primitive brain.
It's protective, but it also can overprotect.
Exactly.
And that's when you go into that fight or flight, it can be your worst enemy when it does that as well.
It's true. And then you think the body's against you, and then there's another conflict.
Yeah. So it's almost like understanding that concept, which is very difficult. It's kind of like learning how to meditate. People really struggle. They're like, I'm never going to be able to grasp this. I don't know how to meditate. I can't do it. It's not in me to be able to do it. It's sort of the same thing. You have to accept that you can do it, right? And I think once people accept it and understand the concept, and there's so many people out there who can explain it. John Kabat-Zinn is great. Lorimer Moseley. There's just so many people out there who'd explain it simply. There's a video on the site. I'm trying to remember where I have it. It's in the videos, view-worthy videos, and it's Lorimer Moseley, just with little cartoons and just describing it in a simple way for people. Because I think that's the best thing to do, right? Just explain it simply. Like, it doesn't have to be complicated. It doesn't have to be a complicated concept, but people do need to understand it to sort of be able to grasp it and use it to their advantage.
Yeah. Well, knowledge is power. And and meditation is also mindfulness. It's just having a mindful. It's just being aware of your breath, being aware of.
Yeah.
And I have a page called Mindful Moment a Day. For chronic pain, because we're all being reminded, and we don't learn mindfulness on a yoga mat. We learn it in traffic.
Yeah.
And yet we get to practice it. And then I meet tons of people, and I joke about me, like, I'll do yoga and then I'll want to split at the end, and they'll be like, the relaxation is the most important. I'm like, no, I got to go. And I get it.
Yeah.
But I'm not stopping to practice being present, to practice being, because I'm just so good at doing. We're all so good at doing. And then when it comes to being, which is when we're being, not only does it relax the brain, puts you into parasympathetic and rest and digest, it actually just balances out your doing. And there's research in this book about the telomeres that you have, your cells will last longer as you age, and you'll age more gracefully if you can practice more being than doing. And I was like, seeing this chart in a book about the cells was all about mindfulness, meditation, breathing, compassion, which we're back to the science of compassion. And this is where you had to learn all this through pain, and pain is a teacher. I think that's what you're saying. Pain is a teacher also.
Yeah. And I think, when you're diagnosed with a chronic illness, the mental health component, like I said, I automatically went into a depression. Wow. Automatic. And it took a long time to get out of it and even figure out how to get out of it. And I was so just tight and just wound up and just so self-absorbed in the condition and obsessive, almost like researching and figuring out what I could do. And I can't eat this, and looking at the IC diet, and then starting to become obsessed with things that I could eat and not eat. And that's another thing. We have to be very mindful of how it could take us down a vicious rabbit hole, right? Which is where I went. And that's why I also, the site is really trying to help people use the resources in a way it's clean, it's simple, get the information you need, try out the different mindful movement, whether it's yoga or restorative yoga or qigong or whatever works for you, because some people don't want to do a body scan, right? That doesn't work for them. So they prefer to do, like for me, I prefer to do something like a restorative yoga class.
Yeah.
That works better for me. So it's figuring out what works best for you. And then, there's diet information as well, helping people. These are the most common foods that can be irritants. These are the most common foods that are often safe foods. Doesn't necessarily mean, you still should do an elimination diet, because perhaps you can eat many of the foods that are on the bladder unfriendly list, right? So it's you got, everyone's different. And I eat foods that other people with IC don't touch because they get flares from it. So it's really just determining what works best for you. And my goal is to give everybody the tools that they need, and it's free of charge. They don't have to pay for anything. They can just go there. They can get the charts. They can find practitioners. They can, do the mindful movement. They could do the toilet meditation. They could do whatever they want on the site. They can read. There's tons of amazing, like I said, the guest blog is absolutely incredible. There's a wealth of information in there, helpful information, tips, tricks, people who have had personal experiences and then have, like you said, became coaches or physiotherapists or occupational therapists or naturopaths who really want to help people, right? So so it's just a wealth of information, and it allows you to be proactive as well.
And how we haven't, now we're talking about the science of hope and belief.
Mm-hmm.
Because if somebody, goes, I love one of the pelvic pages is called Positive News about pudendal nerve,
Mm-hmm.
And whenever I do post, I'm like, positive news, like this is already secreting different chemicals.
Mm-hmm.
So, there was a page about chronic pain, no whining. Okay. So we've discovered a lot of people, they just, the whining kind of serves them in a way. So this page doesn't want whining. And so I think people are getting more educated about the science of
positivity.
And positivity and belief. It's chemical. How many times do we call the doctor for an appointment and we feel better when we hang up? Come on. It's not a coincidence. So I'm going to answer Jackie's question. Thank you for your guidance. I'm struggling because of my TMS work tells me that I need to believe 100% this is a mind-body condition and that it's temporary reversible. So isn't doing the IC diet and continue to look for cellular visibility? No, this is a good point. It's, first of all, TMS, it depends. Even Dr. Sarno was not black and white.
Mm-hmm.
At some point he was having chiropractic and physical therapy. And then he said, well, people are still thinking it's structural. I think I'll stop that and we'll just work on the mind. Mm-hmm. But the doctors that I've been taught, and even Sarno, may he rest in peace, he died at 96. If he was evolving, he would have evolved. Mm-hmm. And he would have said, you know what? You're going to have to do integrative. You're going to have to decide a little bit of this, a little bit of that. So Jackie, it's a good question. Nothing is 100% because you have a human body, which is it's a science. It's an art. Mm-hmm. It's not black and white. You're not a file. You're not a number. So from my point of view and from all the doctors that I work, Dr. Schubiner, Dr. Clark, to always do a mind and body approach. Mm-hmm. So a diet, and this is a good point, I want to make this, yes, the food is important, but what we're finding out now is it's your relationship with the food that will make a difference. So if you're eating something and hating it, that will secrete a certain kind of chemicals and create a certain kind of pathway. So I believe the psychological part the emotional part, the thoughts trump everything. But let me just give you an example of that. A woman I worked with, she was on my show. She wrote a book. She had cancer and she had chemo, and she called it chemo ecstasy. She was determined to have this chemo serve her. So that's the point I'm making. You know what I mean? So supplements, medication, IC diet, it's all
Part of
medicine.
it.
Yeah, I mean, and we can
Yeah.
talk a lot about the placebo. If you believe in these things, they will work, and we're back to the belief. So I know it can be confusing. I know it can be, but you're on the right path, and sometimes it is trial and error, and
Mhm.
having enormous hope and belief, knowing yourself. One of the gentlemen was on my show. He wrote a book called Rapid Recovery. His big thing was having a purpose and a meaning in your
Mhm.
healing. Like he didn't walk for a year and a half because of some horrible back pain and all sorts of autoimmune things. And all he wanted to do was lift his daughter. And that was his goal. And so when he started to work with the TMS work and the different things, he just had in his mind a goal. He wanted to heal. And I will just say there's a research project out. It's actually through my work. I can get you the results. I think it's in Hebrew. The woman's a Russian scientist.
Mhm.
She interviewed 100 people who healed chronic pain and disease. And she found one common denominator, and it wasn't some scientific number. It was just a thread of that each person wanted to heal. They made a decision, they were going to heal. They made a decision.
Yeah.
The decision affected their brain and affected their immune system. And I'm simplifying it. So, Jackie, you're on the right path and you're struggling to progress and continue because that's the way out. I could go on and on
Yeah.
about this. What do you want to say, Marnie, about it?
No, it's just it's a collective, right? I mean, there's so many pieces to the puzzle, and some people respond better to certain things than others, and some people, will do an IC diet, and that's all they need to do, and that works for them, and they go along with their life, and they can keep to the diet, and it's great. But others no. Some people find, there's supplements like companies like Desert Harvest put out these supplements that are made with super strength aloe vera for people with IC. Some people have amazing success with these supplements. Some people don't. So it's really just, like I said, it's trial and error. You just have to sort of figure out, again, what's going to work best for you. And definitely, the brain work is very important, and especially in your situation with having embedded infection, the brain, you really need to try to stay as positive as possible. It's a very difficult um, diagnosis. It's extremely difficult, and so you need to sort of come to terms with it first of all, and then sort of say, okay, now what am I going to do? What are my next steps?
Yeah.
And then with sort of that attitude, like you said, Tovah, healing, having that positive, like I can heal this, because a lot of people if you're in the Facebook support groups, the embedded infection groups can be very triggering, and make you feel unhealthy, negative, depressed. And so I would say, yeah, from all the support group action that I see, that support group, those support groups can be, like I said, triggering. So maybe, stay out of those, to help you with the mind-body connection work, to make it work to your advantage. And then try out different things as well. There's no need to limit yourself in any way. When it comes to pelvic health is complicated, and it really needs to be addressed for everyone. Everyone's got a different story, and everyone's got a different, POA to get them to a better place.
Yeah, and there's I think the thing about what Fred Amir, who wrote the book about the rapid recovery, his big thing is finding meaning and purpose for your healing. And the other part was really believing that your body's not attacking you, really having a healthy relationship with your body. And that this woman with the cancer, she understood her cancer was there for a reason. And that's a different story, but and that's how she healed. And part of it was she helps people with cancer now. And sometimes they don't want to even say the word cancer, and they have to. You have to. I mean, I do say, I'm a little extreme. I'll say you have to love your condition. You have to love.
Accept.
And I'm saying it's hard, but that love heals, and that's one of these movies I promote, because love is awareness. And I learned this from Dr. David Hanscom, who's a spinal deformity surgeon, who's in this work. So I really always say this is not new age. Love is awareness, and awareness is chemical. And awareness that you can say, I'm unhappy with my body and it's upsetting me, but I do understand it. Like, there's a way to communicate and have a language with your body. And they call this the neuroplastic communication. This is part of the quantum physics work, which you don't have to be a Dalai Lama on the mountain to heal, Jackie. Just a normal, regular person like you and Marnie and I. And part of it is really knowing ourselves. And that's what I wanted to say about knowing yourself. So if you could see the way out is the way through, and these bumps in the road and these mountains that you're being forced to climb, that you're not a victim, I think that will help also. And there's a lot of support, like Marnie's group and my world. There's tons and tons of support in my pages. And just don't give up.
Don't give up. Yeah. Self-compassion is also a big piece. And I think that's a big one that a lot of people struggle with, especially in today's world with social media. And
what do you think? Because I asked a psychologist a question. I'll ask you the question. How would I learn self-compassion? How would I learn? How can I'm self-compassionate with other people, but how do I do it to myself? What's your answer?
It's a hard one. I'm going to be honest. But it takes, I think, getting to know yourself better, right? Like just discovering what you like, what you enjoy. If if an hour outside a day is something that you enjoy, then you should do that. And you should give yourself the opportunity to do the things that you love. Whereas I think in today's world, it's just everything's so busy. And people are spending time on things that they don't need to be spending time on, like Instagram.
I love it.
Scrolling.
But they love
it. But it's also super, super, super unhealthy, right? Like scrolling and looking at other people's lives, and looking at other people's lives as better than your own.
Yeah.
When you can be working on making your life better.
Wow.
So
no, it's a great point.
It's hard, right? Like it's so easy to sit with your phone and scroll through, and the algorithm.
If you're aware that you're sitting with your phone and scrolling, then that's it's called cognitive therapy and cognitive therapy, where you're watching yourself and you're not judging yourself. Okay,
yeah.
So you know what I'm taking? I'm taking a cigarette. Instead of a cigarette, I'm scrolling for 10 minutes. It's okay. I believe in balance. It's mindless to scroll, and it's interesting, and it's, you learn a lot from other people. And part of what I want to add to what Marnie said was, I asked this like big psychologist of ISTDP about self-compassion and why it's hard. And she said, well, how do we treat a dog? How do we treat our animals? How do we treat a little baby? Why wouldn't we treat ourselves that way? Why wouldn't we love even the part of us we don't love? I made that up. I did a little YouTube on this. How can we love part of ourselves that we even don't love? Because that's still a relationship. So this is what we've discovered in the neuroplastic work, that if we can have these healthy relationships with our anger, our fear, and fall in love with our body in a way, that's healing medicine. And I wish this was sitting in the doctor's waiting rooms, and it will be in the future.
Yeah. I mean, there have been lots of studies on the benefits of mindfulness meditation. So
It's-
luckily that's now a
Yeah.
conventional approach, and it's, there are hospitals that cover
Yes.
mindfulness programs,
Beautiful.
which is great. But I think we need to go a lot further.
Yeah. Well,
And I
thanks to
still
you.
see, I still see, just just unhealthiness coming out of doctors' offices, right? Like, just, it's fast, and in Canada and in Israel, there's socialist healthcare. So it's different than in the States, but you've got your 5 minutes, quick, get to the point and get out, right?
But doctors, why do we become doctors? Doctors, because they want to help. So inside of every one of those rooms, there's a doctor with a heart. You just have to bring it out now. You have to be, doc, I need 5 minutes. Could you give me some eye contact? And most doctors will probably laugh or bring them a cup, like, be an educated patient, bring them a cup of coffee, bring them a healthy snack and say, doc, I want an extra 2 minutes. The person's going to be late next to, somehow, because most doctors really do care. The majority do care. I think we have to bring it out in them.
Yeah.
And they all have wives and daughters and sisters and brothers. And I think this is part of also the educated patient and the knowledge that people like you and I are bringing to people. And so walk into your doctors more educated, asking the right questions, asking for help, asking for a referral to exercise, to a class and things like that. So I know you have to go, and I want you to leave a few little insights to our listeners. I will. Your support group is on my page already, but I just love your site, and so full of resources. And if like every condition could have a page like yours, migraines and IBS and all sorts of things are going
Fibromyalgia.
It's like this is the future. And I think with Facebook and Instagram, we are finding it. Like, to me, this is my world. It's gigantic. So come into our world, come into MARNIE's and my world, and we'll bring you the resources and the free resources and the help. And I always say, you're the doctor, you're the therapist, you can heal yourself. You can do this, So what would you like to leave with our listeners today?
Well, I think, based on my own personal experiences, just use the platform to your advantage, because it's there for you to explore and help you so that you don't, and help you understand the biopsychosocial approach so that you don't get to a point where you're so low that you don't want to help yourself.
Good advice.
And that can happen easily with chronic health conditions. It happened to me, and my goal is to make sure that it doesn't happen to others.
Wow.
Yeah.
Okay, amazing. I'd love to have you back again. I think there's a lot more to talk about, and we could plug in what you're saying into every condition.
Yeah.
Just plug it in and talk about it, because there's a body and there's a mind, there's a conscious mind and unconscious mind. And I love that you spoke about the brain. You're really knowledgeable. You're just really full of information, and I'm just so happy I met you. And if anybody has any questions for MARNIE, she has a Facebook page and a website, and you can always reach her through me. And I'm blessed to have you come into my studio. Have a wonderful rest of the day.
You too. Thanks for having me.
God bless to everybody out there, and we'll see you next week.
Okay.
All the best.
Bye.
Okay, it's going to go off in a minute. 1 second.